Good evening and thanks very much for joining us. I'm Brittany Ramsey. The Ontario government has unveiled its new budget today. It calls for billions in new spending for healthcare and the economy, but the province's deficits aren't likely to end for at least a decade. Colin DeMello has details.
Amid the third wave of COVID-19 comes the Ford government's second pandemic budget, which places lives and livelihoods above all else.
We haven't beat this virus yet. We are pulling out all the stops to defeat this virus.
Priority number one, vaccinations. The government says it'll spend $1 billion on its vaccination strategy. But the growing hospitalizations are also forcing new spending. $1.8 billion is going to hospitals, including $760 million on 3,100 new beds, $778 million to help hospitals with patient needs during the pandemic, and $300 million to address the surgical backlog, which grew to 227,000. Businesses struggling during the cycle of closures will be getting money in 2021 as well. The government's spending $1.7 billion on grants for small businesses of up to $10,000 to $20,000. 120,000 businesses are expected to benefit, and another $100 million will be given to hotels, motels, travel agents, and summer camps affected by the pandemic. While the education sector is getting limited pandemic funding this year, families are getting another injection of cash. Families are now eligible for up to $400 per child and $500 for a child with special needs. But critics say the government left out thousands of frontline workers forced to isolate during the pandemic. All three opposition parties have called for a provincial sick pay program.
I think the government must have missed the memo, because the pandemic is not yet over. The hurt hasn't stopped in our province, but this budget doesn't even mention the third wave, let alone help people through it.
While the government clocked a record $38.5 billion deficit in 2020, the recovery begins this year. The finance minister is banking on more people returning to work, more businesses reopening their doors, and consumers spending their saved-up cash, sending nearly $6 billion in tax revenue up to Queen's Park. At that pace, the province is projecting lower deficits over the next few years.
This level of debt, as I've said, is not sustainable in the long term. With lower interest rates right now, it's very manageable. And the best thing we can do is get everyone vaccinated in this province and then reopen the economy.
But Ontario will still see a decade of deficits, only reaching budget balance in the year 2029 with a $900 million surplus.
Locally, Thunder Bay Chamber of Commerce President Charlotte Robinson has offered up her reaction on the new provincial budget. She says she's pleased to see more money coming in the form of grants for struggling small businesses.
I'm pretty pleased with the budget. I think that it contains some really needed new funding that will help many of Thunder Bay's small businesses to endure through these continuing difficult days. But there's also a lot of assistance for the months ahead, the support for tourism, for training to get people back to jobs, and broadband infrastructure, which of course we know is going to be important not only now, but over the long term. So pretty pleased to see both the short term and the long term being addressed in this budget.
To COVID-19 now, the past 24 hours have been the deadliest in our district since the pandemic began. 5 new deaths are reported today by the district health unit, and that brings our total COVID-19 death count to 45. It overshadows the encouraging news that our active case numbers continue to fall. Ryan Benazzo has more on that, and also the local vaccine rollout, which has been a source of frustration for many who are eligible for the shot.
5 more families are in mourning after COVID-19 claimed its greatest number of victims in this district over a 24-hour span. Medical Officer of Health Dr. Janet DeMille says while it's tragically inevitable that people will die of the virus, it's still jarring to see so many deaths reported at once.
It just reflects, though, that this is a serious infection. This is a serious pandemic. That has many impacts on us as individuals, families, communities, businesses, schools, and everything.
It comes as daily case counts continue to elicit cautious optimism. 25 new infections were reported on Wednesday. 21 come from the Thunder Bay area, with 4 others elsewhere in the district. There are 6 household close contacts, matching the number of close contacts outside the home. 13 exposure sources are still unknown. There have now been 2,686 total infections. 286 of those are active, marking the first time the district has fallen below 300 in more than a month. Meanwhile, local residents continue to express frustration over the slow vaccine rollout as they encounter glitches in the provincial booking system and appointment slots booked up just minutes after they're made available. DeMille says approximately 6,000 doses will be administered across the district this week. However,
We have more capacity to deliver vaccines than we are getting in supply.
provincially, everyone 75 and older was supposed to be able to book an appointment as of Monday. DeMille notes they're still catching up on those who are 80 plus, but some appointments with 75 to 80-year-olds have been scheduled this week. Both the health unit and Mayor Bill Morrow's office have been inundated with calls from frustrated residents. The mayor, in a letter issued to media Wednesday afternoon, took aim at the provincial rollout, saying in part, "We need assurances that the unique needs of our city and region are being addressed by the province. I also believe the citizens of Thunder Bay deserve a clear and concise answer on why Thunder Bay was not placed on Ontario's list of hotspots." Ryan Benazzo, TBT News.
With many of the area's 286 active cases involving children, the 4 local school boards will remain in virtual classrooms. That news coming from Dr. DeMille today. Online learning will be extended until April 12th, the day of spring break. But as Avery McRae explains, one school has already returned to in-person learning.
For a full year, students and staff alike in Thunder Bay have been riding the teeter-totter of in-class learning and online learning. It has been strictly virtual for Thunder Bay elementary and high school students since March 1st. Lakehead Board Superintendent A.J. Keene says he has heard both negative and positive on the decision to keep kids out of class for a few more weeks, but he believes the medical officer of health made the right call.
We have heard from both staff and families that they appreciate the decision that Dr. DeMille made that will help prevent the spread of the transmission of the virus in our schools.
The Catholic School Board in a statement recognized the importance for children to have in-class learning for the students' mental health and well-being, but understand the importance to keep students and families safe. While active cases in the district have fallen below 300 for the first time since late February, Dr. Janet DeMille notes many of the cases over the past month have involved kids.
We see school-age children still getting COVID, and it's a fairly elevated number, and it just reflects what's happening in our community.
We know for the last month there's been well over 110 cases of school-age children. So if you think back to before the pivot, all that was happening in the news around our schools, one student with a positive case could trigger 70 to 80 different students having to remain home.
With all that said, one school in Thunder Bay has reopened to in-person learning this week. The Thunder Bay Christian School, located in Roslyn, reopened this past Monday, and Dr. DeMille cited the school's strong safety plan and other unique circumstances that pertain to the school.
I think there were challenges as well for that school in providing online learning because of a number of their school community didn't have easy access or good Wi-Fi, and in fact, when access to do virtual school, that in fact was one of the bigger reasons.
Avery McRae, TBT News.
The COVID-19 situation in Thunder Bay was once again a hot topic at Queen's Park. The Ontario NDP is voicing concerns on what's being done to help bring the community spread under control. Temiskaming Cochrane MPP John Vantoff says Thunder Bay has been struggling with outbreaks that continue to pop up citywide. Vantoff took issue with Doug Ford's recent comments. He says the Premier basically told the people of Thunder Bay to wait until the hotspots in the GTA are under control.
If the provincial government is treating other areas that should be priorities, they're being so slow, how long can Thunder Bay expect to wait until they get the attention they deserve to control what is a crisis situation?
Dr. Williams is in contact with a local medical officer of health on a daily basis, and if further assistance is required, further assistance will be given in order to assist Thunder Bay in getting this transmission under control and allowing them to move into another level of the framework.
Casual staff at the Thunder Bay Public Library are the latest to bear the brunt of the pandemic. This week, the library issued letters of termination to 20 casual staff, citing a lack of work for the foreseeable future. The library says reduction in operating hours has meant casual staff who supplement the library's 75 permanent full and part-time staff have not worked for a full year now. The library also provided the CUPE union with a 30-day notice for other potential COVID-related layoffs. The library's director of resources says the pandemic will be the main factor in what happens next.
We provided the union with notice that there could be potential layoffs if the library were to close again. But as much as possible, all unionized staff who can perform meaningful work are working from home or in the library buildings.
Bray says the library has kept all permanent staff working as much as possible over the past year while keeping the safety of staff and the community at the forefront. One member of Thunder Bay City Council says he and his colleagues shouldn't have to cast a vote every year on whether or not to give themselves a raise. Neebing Ward's Cody Fraser says it's time to simply lock in the city policy that was established in 2018, which entitles the mayor and councillors to a pay raise that's equal to half the annual rate of inflation. This year, that meant a $190 pay raise for councillors and a $575 bump for the mayor. Fraser believes the information should still be presented to the public each year, but should be implemented without a council vote, unless councillors want to forego the raise. Fraser says forcing councillors to vote on their own pay increase becomes an annual political flashpoint within the community.
0.5 CPI is around $190, which is obviously exceptionally modest. But even despite that fact, it's become a huge issue. And to me, it's a distracting issue when there's other issues at play that we need to be talking about. You know, if we were getting a raise of thousands of dollars, that would be another conversation to have, obviously.
Fraser adds it's important for the salary of elected officials to keep up with inflation in order to continue to attract good candidates. He plans to bring a motion forward later this spring asking to make the change. Thunder Bay Police are reporting a second arrest in connection with a break, enter, and assault this weekend. Officers were dispatched to a West Amelia Street home early Sunday morning in response to a complaint. Upon arrival, they learned 4 men had forced their way into an apartment and attacked 2 people inside with a weapon. At least one of the attackers was known to the victims. 2 of the men apprehended so far are facing assault with a weapon and break-and-enter charges. The investigation remains ongoing. A shortage of emergency services was one of the focal points on day 2 of NAN's virtual Chiefs Assembly on health transformation and governance. Paramedicine is vastly different for remote and isolated communities than it is in cities like Thunder Bay, and officials with NAN believe there are a number of improvements that need to be made. Ovid Mercredi is NAN's health transformation lead and presented at the session. He says they hope to offer training so that if there is an expansion in the number of paramedics in the 49 First Nations, they can be within their home communities.
We want to develop a curriculum that does 2 things. One, it has to be relevant to our people. It has to also be according to the standards that are available right now for training paramedics in the province of Ontario.
Set aside funding for paramedic services for NAN communities without first responder coverage. The second Thunder Bay 50/50 lottery has soared past the $500,000 mark with less than 48 hours to go before ticket sales close. Previous jackpot reached over $965,000, with that same amount going to the Thunder Bay Regional Health Sciences Centre Foundation. The net proceeds help fund vital medical equipment for the hospital. Foundation spokesperson Heather Vita says they're very happy to see how successful the second draw has been.
I don't think I can emphasize enough how much this means for our fundraising. We can't have any in-person events. Kids are not at school. Our lives have changed drastically, and without the revenue from a lot of events that we typically have, we just lost that. So this is bringing in extremely important revenue for us, which again goes directly back to the hospital, providing beds, ultrasounds, x-rays, you name it.
The take-home jackpot currently stands at around $530,000. Tickets can be purchased online and are on sale until Thursday at midnight. The winning ticket will be drawn Friday, 11 a.m. with the 50/50 for next month opening right after.
Not too much time left, but if I had to guess, that jackpot's going to go up and up
Yeah,
and
I
up.
bet.